Okay, are you ready? I'm gonna bend forward and I'm gonna twist. Ah! I just hurt my back. Did you know that bending and twisting is the #1 cause of back pain and possible disc injury? So we were told that we should avoid bending and twisting. I'm gonna say, what a bunch of nonsense. We should not be telling people to avoid bending and twisting. It's a fundamental thing to do for the spine. We are meant to bend and twist. We're not meant to be up tall all the time. Mothers are supposed to bend and twist to pick up their babies from the crib. Construction workers bend forward to pick up bricks and throw them across. So telling a patient with acute back injury to maybe for a few days, at most a few weeks, avoid bending forward and twisting, maybe. However, after 3 months or 3 years telling a patient you should avoid bending and twisting because it's a cause of back injuries, it's insanity. It's like telling people you should stop walking, because walking is the #1 cause of ankle injuries and ankle sprains. Therefore, walking is bad for you. Sounds crazy when I say it like this. So the single best way of preventing flexion and twisting back injuries is by having it included in the rehab and gradually loading it. The reason people often injure themselves in this position is not because that posture is bad, it's because physically they were not able to tolerate the load that they were placing on themselves. So inherently, doing that activity is not bad. So as physiotherapists, we must avoid vilifying certain movements and directions of the spine because it further adds to their belief that I am a fragile human being. If I twist and bend, I'm gonna break my disc, I'm gonna ruin my facets, when that simply is not true. I like to give a shout out to Greg Lehman, who introduced me to this term, physical homeopathy, which simply means, as clinicians, we should expose our patients to the movement or activity that actually caused their injury, gradually, meaning with graded exposure. If flexion and twisting was the cause of their injury, instead of vilifying it and avoiding it, we need to actually start them with that, with micro doses of it as soon as possible.